Good evening, everyone, and welcome to the Upside. I'm Jonathan Oleski with Jaymore, and our show is about to begin. To maximize the experience, we recommend putting your Zoom screen on speaker view. Now, it's my pleasure to introduce our two fabulous hosts this evening, Beth Goldsmith, Chair-elect of the Associated Jewish Federation of Baltimore, and Dr. Scott Rifkin, publisher of Jaymore. Scott and Beth, take it away.
Thank you, Jonathan. Welcome to The Upside. This is our virtual show brought to you by the Associated Jewish Federation of Baltimore and Jaymore Magazine. The idea is let's keep our community, our Jewish community, informed during this time of COVID epidemic. Beth?
Thanks, Scott. We are coming to you twice a week with episodes you can view live on Zoom, Facebook, and YouTube. And each episode tackles some of today's most pressing topics, features some of the community's leading experts, and answers the questions that are on all our minds. Today's episode will focus on our nursing homes and long-term care facilities. Just last month, concerns about nursing home safety resulted in Maryland agreeing to release data on coronavirus infections and deaths at long-term care facilities. With many of us having parents and grandparents living in these facilities, we obviously have a vested interest in what they are doing to keep our loved ones safe. And we are very fortunate tonight to have on our show two experts from the state's nursing home associations. Scott, will you do the introductions?
Well, I got to tell you, I'm thrilled. I rarely get to do a show with two gentlemen that I have known for a combined, I think, 60 years. At least, I've known each of you guys for at least 20 years, and I've been involved in both associations. What's that?
Definitely. Since I've been in Hawaii, you and I have known each other.
That's right. So that's Joe DeMattos, who's president of the Health Facilities Association of Maryland, and Kevin, wave your hand if you would. Kevin is president of the Lifespan Network. Those two gentlemen represent every nursing center in the state of Maryland. They even have some overlap where some facilities are members of both, and really know more about what's going on in long-term care centers than anybody in the state, certainly more than anybody in the government. And they're the ones dealing with what's going on with COVID. And as most of you know, the virus has been tough on the community. It's been really tough on nursing homes. People in nursing homes live close together. They have staff that goes in and out of their rooms, and they're frail by nature. So it is a huge issue, and we've had lots of patients who got sick and patients who died in them. So let me take a minute and ask each gentleman to sort of say hello, say a few minutes, a minute or so about their organization, and then we'll start posing questions. Beth has some, and I have some, and what our goal today really is to help people understand what's going on in the nursing center, and how they can help their mom or their dad who either is in a nursing center or needs to be in one. So, Kevin, you want to go first?
Sure. Thanks, Scott. First of all, thanks for having me. It's a pleasure to be here. I think back to the early 2000s when you and I were hosting Focus on Seniors on WCBM. It's been a long time. Had a lot of fun doing that. But I wanted to just start by saying how pleased I am to be able to do this with Joe DeMattos. We've been friends and colleagues for a long time, and particularly during a time like this, we've worked together, interacting not only with the health department, but also with other organizations around the state who are impacted by this. And really, this has been a scenario where we've attempted to pull together in the same direction and to do what's best for the vulnerable adults and staff who are in nursing homes. So Lifespan is an association of about 250 organizations, not only nursing homes, but also assisted living facilities, home care providers, hospice, even a couple of hospital members and adult day providers. So really a diverse collection of organizations. And it's been really our pleasure to work with Joe and with others to do the things that we can to advance the cause for seniors.
Very good. Thank you, Kevin. Joe, give a little bit about HFAM, please.
Well, first, Kevin, thank you so much for your kind words, brother. They really touched my heart, and I appreciate it. And since we're on a call sponsored by Jay Moore and the Associated, I want to thank Beth so much for all that you do with the Associated. You've always been there for me, whether when I was president of Har Sinai or Acharai, or now at the JCC. We're walking together into this unknown time, and we'll get through it together. There will be a start, a middle, and an end to what we're facing now, and we'll get through it together. We'll get through it together. Scott, you were kind to remember that we've known each other for about 1 million years. I want everybody on the simulcast to know that when I was working on nursing home reform for AARP in Hawaii in the late 90s, early 2000s, I got word of a doctor in Maryland who I have to speak with about how to turn around nursing homes and assisted living. And so while I was trying to do that in Hawaii, long before I ever thought I'd move to Washington, D.C. or Pikesville, Dr. Scott Rifkin was my expert. So I just want the world to know that. It's been a long time.
Yeah, but
So
the world, I'm told the world's passing me by, Joe.
Well, you know, all of us, but we're still together and we're still making a difference. So Lifespan and HFAM are mirror organizations, and we have several members in common. We're both about 250 members, and we both have been around for many, many, many decades. And I guess the one membership difference between the two of us is that Kevin's Lifespan represents adult day and some CCRCs, which is a real strength, as well as assisted living and nursing homes. And we represent nursing homes, assisted livings, and associated businesses. But it's interesting because we're both about 250, we're both decades old, and we have some that overlap. So one of the upsides of all of this is that I get to work with Kevin, who was arguably my best graduate student at UMBC when I was teaching in graduate school there, all right? So there are many, many layers. The one thing I would say before we get into Q&A is that Kevin and I in the sector have been fighting an uphill defensive battle against COVID-19 since late January. And quite frankly, we will continue fighting this defensive battle until there is a vaccine. There'll be ups, there'll be downs, but precisely for the reasons that Dr. Rifkin mentioned, the fact that nursing homes, assisted living, and CCRC campuses specifically care for people with pre-existing conditions, and COVID attacks most violently those with pre-existing conditions, we're going to be fighting it for quite some time.
Very good, Joe. Thank you. Maybe the place to start, and Beth, I know you've got a list of questions too, but let's start with sort of the status report. Maybe if each of these gentlemen could give us a few minutes on what they're seeing out there, how many buildings are affected, how badly they're affected, and what they're really hearing from the members that are running these facilities and trying their best to figure out how to save these patients' lives.
I guess I'll jump in on that and ask Kevin to hit cleanup for me. We do that well together, he and I. So every community in Maryland is a microcosm with regard to COVID-19. So we saw that the 21215 zip code in Baltimore City was the first true zip code-wide hotspot about a month ago. I was actually at that nursing home, not in it, this morning, and they've calmed down quite a bit. So they were the tip of the spear. We also saw a tip of the spear in Charles County, maybe 6 weeks ago, with a skilled nursing and rehab center there. There's definitely an intersection between pre-existing conditions throughout the community, healthcare disparity, social economic impacts of health in the community at large, and in the nursing home, assisted living, and the CCRC. And so there is a relationship between how hot a zip code is and how hot the centers in that area are. And so we're seeing the places that were really hot a month ago get cooler now. So a month ago, the hot spot was Baltimore City. And about 10 days ago, it was Montgomery County. And today it's Prince George's County. So while most of the skilled nursing and rehab centers in Maryland, the majority of them have COVID cases with staff and with residents. There are some that don't, but most do. We don't have a handle yet on CCRCs and assisted living, There are more people that are recovering now daily than who are dying. But as Dr. Rifkin said, because of the frailty of the folks in our care, people are dying at about the same rate as people did in hospitals in New York City. So I think we're still hot for a while now. It goes by community to community, and it's pretty prevalent right now. And we've been fighting it defensively, really aggressively, probably since middle of February, preparing since January. Kevin, what would you add?
Yeah, I think Joe's right on target. I think we've really pulled together a whole host of organizations to try and move things forward for nursing homes and some of the other communities, retirement communities, as Joe mentioned, assisted living facilities. But it really, from my perspective, began with the effort to secure the PPE that was so desperately needed, the protection, not only for staff.
Kevin, explain what you mean by PPE. You mean masks and
Sure.
gloves and face guards and gowns and that sort of thing.
Right, exactly. So personal protective equipment. So we were fortunate to collectively be able to partner with Dr. Rifkin and Strategic Factory, a local company, to procure PPE for nursing homes, for assisted living providers. It was a massive effort. And so having a HFAM lifespan pulling together to be able to access materials that nursing homes, quite honestly, had not been able to get was a big deal. The first thing that we need to do is to protect our older adults and to protect those who are caring for them. So the PPE was one of the first steps in all of that. And that's been a long running, as Joe said, we've been fighting from the beginning, an uphill battle, but you're beginning to see in nursing homes and in other senior care environments that begin to level off, providers be able to get the supplies that they need. Still going to be a challenge, but that's a big part. The other thing that everyone has been talking about, as you all know, lately is testing. Testing is something that we've been advocating for many weeks, and testing is beginning to roll out, as you've probably seen in the newspapers, through the health department and in partnership with the National Guard and local health department. And so testing is ongoing. And as you might imagine, the challenge with testing is once you have positives, particularly among staff, you've got to remove staff from that environment. And so the challenge is getting additional nursing staff, additional other staff into the environment to be able to replace them. So we've been working in partnership with the health department and many other folks to try and make that happen. So things are progressing. They're moving in the right direction. As Joe said, we're beginning to see the impact of the efforts of a lot of people, but we've still got a long road ahead.
So thank you, Kevin. So let's talk about the life of a patient in the nursing home. And then I'm going to flip it to Beth to ask some questions. I apologize, Beth. I'm being a little dominating here, and I apologize. I will tell a funny story, though. Many years ago, and I've got someone, Joe, as well. Joe and I were involved in a mugging together once, many years ago. Remember that?
He saved my life.
But the other story is Kevin and I did a radio show many years ago together on CBM radio, and the association was buying the time. It was like 9 a.m. on a Sunday, and we didn't know if we had any audience. So we sort of goofed around a lot. And I told the audience that Kevin was actually Hugh Heffner's son. And I would say that all the time. And to this day, he hears it from people who think he's Hugh Heffner's son. In fact, I told that to Jonathan, who's our moderator at some point, just to pull him into it. So anyhow, thank you guys both, you guys being here. By the way, you can ask questions online. We typically have about 1,000 people who watch this show, some live, some on Facebook, some on Zoom, some on some other things that I don't understand. And Jonathan can go through those. And then they can also watch the show later if 7 o'clock on a Thursday night isn't the best time for them. So anyhow, get your questions in and we'll pose these to these two gentlemen who are experts. What's the life of a patient in a nursing home like right now?
Well, it's really challenging right now. And I guess some context would be important. So back when I was working on nursing home reform in Hawaii in the 90s, if you were in a nursing home, you drove up with your family and you were in relatively good health and you were predominantly a woman and you had a suitcase and you marched up to the door and your family said, this is your new home. And you lived for a fairly long amount of time in that nursing home, really more like what we think of as assisted living now. And that was that. If you fast forward the progression of nursing homes from that time, Clinton administration, to the present, people arrive at nursing homes via ambulance from the hospital. There are many, many subsectors of those folks, but two big subsectors are people in their 50s or 60s after a hospital stay who have to rehab, maybe need intravenous antibiotics for some time. They stay in for 30 days. Many of them can stay in less. And this is part of the leadership of Dr. Rifkin. He got his length of stay down to like a week or 12 days. He's brilliant. But they typically stay, let's say, a month, and they go home, and they're younger. They're like from their mid 50s to their 70s. Then there's another group of people who in 1995 would have been in and out of hospitals for long periods of time, really, really sick people with multiple chronic conditions. So congestive heart failure, diabetes, renal failure. In the mid 90s, the way we took care of those folks across the country is they were living in hospitals for long stretches of time, back and forth, and then eventually they passed away. Well, since about the last decade or so, maybe a little bit more, those folks make up another group that live in nursing homes. They arrive via ambulance. They're 80 to 83 years old. There are subsets who are much younger. They have 5 or 6 conditions. The majority have some form of dementia. And they live their last year and a half to 2 years needing assistance with everything they do in a nursing home. So that's who are typically in a nursing home. So if you can imagine fighting a virus that we knew nothing about 5 months ago, which is largely asymptomatic, that requires you to move people around in the nursing home to keep them safe, in an environment where PPE has been in short supply. And I got to tell you, Kevin understates his leadership. He needs a national award on what he's done on PPE. It's been our joy to share with him and to work with him on that. He's been exceptional. But imagine a world, this invisible virus we knew nothing about. We don't have a vaccine. We don't have enough testing. The majority of people in the nursing home have dementia. And for their safety, we had to stop visitation because we didn't know how it spread. So right now, today in a nursing home, you have these healthcare heroes who are fully gowned up, mask, eye shield, head shield in some cases, gowns, gloves, taking care of people in that kind of a setting, fighting to save lives and trying to stop the spread of this disease, all in relatively isolation and with under supplied, really.
And generally underfunded by government.
Yes, incredibly underfunded by the government.
Kevin, your thoughts?
Yeah, Joe is right on target. And I think, given what he was describing, we call acuity creep, that the folks who were in hospitals 20, 30 years ago or in nursing homes, the folks that are in nursing homes 20, 30 years ago are in assisted living. But to Joe's point, imagine yourself being a resident in a nursing home where you're going to be living for a year and a half, 2 years. You develop relationships with, as Joe correctly indicates, healthcare heroes who become your friends, people that you see on a regular basis who take care of you. And just over the last several months, even several weeks, now you're seeing them in a way that you've never seen them before. They are fully gowned and wearing shields. It's not frightening enough that now you're seeing people who are taking care of you in that way. Your family is is not able to visit you. And as Joe correctly said, it's for the protection of the residents, for the protection of all of us. And it was absolutely the right thing to do. But imagine being in that nursing home, and as I described, the people who are around you are now wearing much more equipment, personal protective equipment. You may have someone who has become your friend who may be sharing a room with you who's been relocated because of COVID. So they're no longer there. And it's increasingly challenging for nursing homes to be able to connect you to your family because they're so stressed and so overburdened. And Scott couldn't be more correct about underfunded. It's more challenging for them to be able to connect you to your family members, even by Skype, by Zoom, because they're doing so many other things to protect residents, to protect other staff members, that kind of thing, the communication can sometimes fall by the wayside because there are other more pressing health concerns that have to be dealt with. So I can imagine, and you can imagine, it would be a very frightening thing at this moment to be a resident in a nursing home.
And throw on top of that, that most of these patients being confused, as Joe and both of you mentioned, they don't interpret the things done around them the same way. And it's very confusing for folks. And it's a big part of the issues. Yes.
Scott, we
Go ahead,
have
Jonathan.
3 questions from our audience tonight I'd like to ask our guests. So from
Okay,
Facebook,
let's do that.
for
But first,
Joe and
I think
Kevin.
Beth had a. Go ahead.
Beth, do you want to ask a question first?
I'm happy to have the audience do it. And I just wanted to
Very
say,
good.
I do have some questions that I think are really important, but I'm happy to let the audience weigh in. And Kevin, I'm going to contact you after the show, since you shared a stage with Scott before, and find out how you got a turn.
I'm guilty.
All right, so here we go. 3 questions from the audience. The first is on Facebook. Are there changes in regulations or policies that you think will continue after the epidemic, after the pandemic?
Great question.
Yeah.
Which one of you got to take it?
So there are changes that we've asked for that will continue. There are changes that we asked for and weren't granted that we'll continue to ask for. And I would suspect that there'll be much more vigorous training requirements. You have to understand that in January, when we were first dealing with COVID-19, what the federal government was telling everyone about it was that it was the latest, greatest SARS virus. And so the notion was that you could use a traditional infectious disease protocol with symptoms and people gowning up, and you could fight this thing. And we now know this virus is way, way, way more complicated than any of the previous SARS viruses. This latest news about so-called Kawasaki-like syndrome for kids is just absolutely crazy. So think about that. Normally in a nursing home, maybe about 15% of the workforce trains to don and doff PPE gear for a flu season, maybe 15%. We now have 36,000 employees who have to don and doff PPE every day, 3 shifts. The majority of folks, they don't work in hospitals. They're not used to doing that. So one regulation that I think will likely change is the training requirement relative to donning and doffing. And Kevin and I are working on this now in terms of providing simple guides to the staff. You can find it on our website. So yes, is the short answer.
Great. Okay, so from Melissa on Facebook, and maybe Kevin could jump in on this one. What about the 21208 and 21209 zip codes? Any thoughts on those 2 hotspots?
Maybe I'll jump in, Kevin, since I live in them.
Yep.
So they're hot, but they're not as hot as other zip codes. I'm in 21209. Most of my family, my in-laws, are in 21208, and they are hot. We have cases in nursing homes and assisted living in these zones, but they're not even remotely as hot as hot spots in the city and Prince George's in Montgomery County. Again, those of us that live in 21208 or 21209 know that, and Neil Meltzer has made a quest of this in his leadership at LifeBridge. You know that when you cross on Park Heights over Northern Parkway, that the social determinants of health change dramatically, right? And so we're seeing this in COVID-19. So 21208 and 21209 are hot, not nearly as hot as other zones.
You know, from a consumer perspective, I would assume everywhere's hot.
Yes.
Because it's all over the place. And even the nursing homes that have not had an outbreak, most folks feel they're going to eventually have an outbreak.
Well,
it only takes one patient, one family member, one employee walk in the building, not know they're symptomatic, and it spreads like wildfire. This is way more contagious than regular influenza.
No doubt.
Jonathan, you had another question?
Yep. Here's a question from Ben here on Zoom. A great question here. What is the opinion of the experts in this group for when you both feel a vaccine will be readily available? When will the vaccine be ready?
Boy, that's a $64,000 question.
Yeah, sorry, I didn't mean to put anybody on the spot, but we hear about it every day, different stories from different people, and I'm just very interested to know what your thoughts are.
Ben and I went to high school together. It's a small world.
Well, I'm not as you're a lot older than I am.
The medical answer to that question is we don't really know. And it could be a year, it could be 5 years, it could be never, is the honest answer. Now, Anthony Fauci, who's way smarter than anybody I've ever met, believes that it will be possible to get a vaccine. And he had reasons why he thought that particular virus is amenable to a vaccine. Not all viruses are. And he believes there will be one, and there will be one in a year and a half to 2.5 years. And I'm willing to go with his opinion because he's just the smartest guy out there on this stuff.
Do you think we'll be wearing masks that length of time?
Most people suggested I wear one my whole life, but yeah.
No, no, seriously, I'm just asking because it's not a good way of living, you know.
See what these guys think, but I think it's the new norm. I think people are going to get used to it. I think when you go around Japan, for years, people have been wearing masks in public. I think it's going to become a very socially accepted thing to do, to walk around with a mask.
Wow.
Beth, you got a list of questions.
Yes, sir. Yes, sir. Hi, everyone. I'm going to ask 2 questions because they're very interrelated, and that way I'll know that I'm going to get them both answered. I want to start with the fact that it's been a long time that we've been isolated. So people's conditions have changed. And also there could be a sudden onset of a problem. So suppose someone, one of our parents or even a spouse, suddenly, or it has been eventually, needs to go to a nursing home. Should I be putting them in there now? And if so, what homework can I do since I can't visit? And the second part of that is, for those of us who already have people in nursing facilities and can't visit, what are the questions we can ask or should be asking to make sure that things are going well, or that we can find out what's going on with those people?
Kevin, you want to go first?
Yep, great questions, Beth. You know, one of the things that occurs to me that in all of this has been among the most heartbreaking stories that we all hear is of older adults in nursing homes who are, by their very nature, very frail, very sick, not being able to communicate with family members until they are in the end stage of whatever their comorbidities are. And it's heartbreaking to hear the stories about how family members can't connect. And as you know, there isn't always a clear path to end stage. People die in the nursing home that you don't expect to die, and before you expect them to die. And so from my perspective, one of the things, and I'll just start with one and then defer to Joe, is I'd want to know what the nursing home is doing to be able to improve the ability of residents to communicate with their families. What are you doing in terms of implementing technology, using resources that you already have, emerging technologies that may not require intervention from a staff member? I'd like to know that the nursing home is on the cutting edge, or at least thinking about these things, so that I can continue to communicate with my family member.
Oh, Kevin, that's a great foundation to build on. You're spot on. I would say first the same thing that I said pre-COVID with regard to having a family member in a nursing home, and that is that I would be guided by the clinical need of my family member. People should be in the level of care that is most appropriate to them relative to the intersection of their clinical need and their safety. So if the sweet spot for my loved one is to get the appropriate level of care clinically and to be the safest in a nursing home, then I would, even in the era of COVID-19, have that family member in a nursing home. Like Kevin, I would want to have pretty direct contact and speak with that administrator and that director of nursing before that transfer was ever made. Prior to COVID, I would have told a family member to absolutely meet face to face, even if briefly, with the administrator, with the director of nursing, not just the discharge folks. In a COVID world, you can't do that. I would ask what level of communication can be provided. And people have been really creative. There are nursing home providers that went out in the early days of this and spent tens of thousands of dollars on iPads to do FaceTime and Skype. Now, if Kevin pointed out, though, as it gets to making a decision on, am I going to make sure I'm providing care to you versus making a FaceTime connection, the care is always going to go before the FaceTime connection. I've also been talking with families who have done things like put Alexa in their family members' rooms. And so then family members don't have to like fiddle for a phone, or you don't have to arrange a drop off of a designated cell phone. You can just call the family member on Alexa and vice versa. So that's happened as well.
Very good. Beth?
So
go ahead,
I
Beth,
will yes, well, you mentioned earlier, Scott, so I would take this a little further, or maybe Joe mentioned it in speaking, that a lot of people in nursing homes really are already confused, don't necessarily understand everything about their surroundings. So how is social distancing working at all if people are mobile there? How are you dealing, or how are the nursing homes dealing with patients who may not understand what's going on?
Well, it's a challenge, first off, just straight up, it's a challenge. But secondly, the caregivers establish these relationships and understand their patients in ways that I've seen that are absolutely miraculous. So one of the impacts and effects of these various types of dementia are different time cycles. People sometimes have auditory triggers versus visual triggers. And so the caregivers know about all this stuff, and they knew about it going in. And it really does come back to something Kevin and I have studied together for many, many years. And that is this concept of treating the whole person and knowing the whole person and recognizing that the woman in 2A is not just a mirror version of the woman in 3B. And so it starts with that understanding. Let me tell you, under these circumstances where people aren't recognized because they're wearing gowns and masks, it's way, way, way more challenging.
Very good. Very good. The talk a little bit, I guess, talk a little bit about isolation and what the facilities are doing. If you've got mom or dad and they need to be in a nursing home, some facilities are creating units where they know they don't have any of the disease. and isolating those units. Talk a little bit about isolation as a tool for safety.
Well, this is, again, an advantage of Kevin and I and the sector working together. We actually were preparing members and advocating for the creation of isolation units ahead of government orders. So we now live in a Maryland where there is a government order that nursing homes create essentially 3 sections. Normal general group of patients that are not COVID positive, isolation areas where people are COVID positive, and observation areas where you don't know the status of those folks. And again, one of the real upsides of this incredible tragedy has been working with Kevin and having us advocate and preparing nursing homes to do that before it was ordered. But frankly, here's the rub. Not every nursing home is physically laid out so that you can have adequate beds in each of those sections. So what gives in that are the observation beds, because you have to have people who are not COVID positive in one area, and you have to have people that are COVID positive in another one, and that's happening everywhere. Everybody has isolation, has observation, but they could range in size in a nursing home from 4 beds to 40 beds. And that's a challenge, and that's especially a challenge in a world where we haven't ramped up testing to where it needs to be. And testing is more than kits. It's kits, reagents, swabs, and labs. And none of those are perfectly aligned right now. So Scott, in answer to your question, we've got all 3 sections in nursing homes: isolation, people who are not infected, and observation. But very frankly, for our Facebook audience and Zoom audience, it's those observation areas that are really problematic, especially given the lack of testing.
Gotcha. So let me start this with Kevin. You've got a lot of employees that come into the nursing home. They're being asked to do something pretty remarkable, which is to come into a nursing home knowing they're putting their lives at risk. And it's not all doctors and nurses. It's also folks who clean the building. It's nursing aides. It's people in the kitchen. They don't get paid a lot of money. How are they doing this?
You know, that's one of the challenges that we've been collectively talking about for years, is valuing the people who are caring for older adults and frankly now putting themselves in harm's way every day. You mentioned it's not just doctors and nurses, but a whole variety of dining staff, housekeeping staff, administrative staff. There are lots of people and contractors who are coming in and out to provide pharmacy services, food, all sorts of things. They're putting themselves in harm's way. And I think one of the overarching messages that we would like to come out of all of this is that we need to do a better job of valuing older people in our country and valuing the people who take care of them. You know, we hear a lot about hospital heroes, as we should. There are many of them, and in all across the state of Maryland, heroes in hospitals who are putting themselves in extreme danger, but in nursing homes as well, in assisted living facilities. We need to focus on valuing the people who care for our most vulnerable, our grandmothers, our grandfathers, our loved ones, and to be able to compensate them and protect them in the way that we should. And that's a national conversation that we need to have, that gets to sort of some societal things about the dignity that should come with growing older, and the people who care for those who are growing older. And I think we've got a platform. I talk about silver linings all the time. There's nothing good about COVID, but there are some silver linings that result. And one of them is being able to have a platform to have a conversation about putting people into nursing homes, dignifying that work, and dignifying in turn the people that they care for.
Very good. Joe, some thoughts on that?
I think Kevin hit it out of the park. I wouldn't add anything to that.
Good. Beth, other questions?
I would just ask if there's anything we haven't asked that either Kevin or Joe wants to share with us. What haven't we touched on? What do you think is something really important that you feel you want to make sure that people leave this show knowing?
Kevin?
Joe, I'll defer to you on this.
Oh, I appreciate that. Thanks, brother. I think the only thing I would remind people of is a couple of points. I think the most important point is that people that are working in skilled nursing and rehab centers, assisted living and senior living are fighting every day to save Marylanders and to protect them. And frankly, we read a lot about the number of deaths and the number of cases, but there are more people recovering than who are dying. And it's important to just call that out. I'd point out what Dr. Rifkin said, and that is that we are entering, I think, a new normal in the country, not just in our part of healthcare, but in the country in general. And we will be in this new normal for a while until there is a vaccine. And there will be a beginning and a middle and an end to each of these sections. I think we will enter a better period here in June. I pray every day that that's the case. But the likelihood is that it will be cyclical and we will be fighting this defensive battle together until there's a vaccine, but we will get through it together.
Very good. Very good. Beth, I think we'll end it there. And if you've got some announcements.
I do. First, I just want to thank Kevin and Joe. Thanks, obviously, for being here today. And thank you for what you're doing for us, for our loved ones, and helping us know that there is a safe place for them. This is obviously an unprecedented health crisis. So thanks for being there in regular times and particularly accepting and running with this challenge. Our next show is Tuesday at noon. So we hope everyone who's listening will join us then. I also hope for anyone who found tonight illuminating to please recommend it to your friends. They can view us after the fact, so make sure people know that. Just a reminder, Tuesday at 7 p.m., Jewish Community Services is joining with Saul Levinson, the Baltimore Board of Rabbis, and the Baltimore Jewish Council for a virtual memorial service that will include both prayers and ritual. To learn more, go to sollevinson.com or jcsbaltimore.org. And finally, if you or a loved one needs help, JCS has a hotline, 410-466-9200. So please continue to visit associated.org, jmoreliving.com. There's information, stories, and resources for all of you. And I will just say to everyone, please be well.
Wonderful. Thank you, everybody. Have a good evening.
Great.
Thank
Have
you.
a good night, everyone. Be safe.
Take care.